We wanted to turn now to some updates that we're getting from the public health front. And so we have with us Mecklenburg County Public Health Director, Dr. Raynard Washington, joining us here on Live Impact News. Dr. Washington, thanks so much for your time. We have a couple topics we'd like to hit with you today.
Great to be here.
All right, so we'll start off, Dr. Washington, with some of the changes in the guidance for COVID vaccines, because we've seen kind of over the last few weeks things evolving as far as what federal officials are recommending. So I feel like it's a little bit confusing. What can you do as far as boiling down the changes for folks at home watching?
Sure. Essentially, we heard from the Health and Human Services Secretary last week, I believe it was, that the FDA would no longer be recommending the COVID-19 annual booster for some subgroups in our community, specifically younger adults under the age of 65 who did not have any underlying health conditions, as well as children. There is a very long list of underlying health conditions, though, that would exclude someone from this new recommendation, and that includes a wide range of physical health conditions, many chronic conditions, hypertension, diabetes, and more complicated conditions as well, in which case those individuals would still be recommended to receive the annual booster at this time. And so I do encourage folks to talk with their primary care providers, reach out to us here at the health department if they have questions, if they'd like to know if there's anything that's changed for them. Of course, we are in the middle of the summer months now, and so we don't expect a new booster until later on this year in the fall. So around that time, ahead of the new boosters being available, we will also be sending out pretty clear communication about who's recommended and who's not.
I guess one of my curiosities here is if I'm not really recommended to be getting the booster, but I still feel like I want one. Is that something that I could still potentially discuss with my doctor and see if I could get it anyways? Or is it simply, you're not going to get it now this year if you're not on the list?
Yeah, no, certainly. You should certainly have that conversation. There's still a lot of uncertainty. I will say typically this is not how recommendations for vaccines are made in the country. Typically, the Advisory Committee on Immunizations that's at the CDC makes recommendations. The FDA typically does approvals of medications. So this is a bit of a deterrent from our usual approach. But again, ACIP is meeting later this month, the Advisory Committee on Immunizations. So it'll be interesting to see what happens there. What I think some of us in public health are a little concerned about is that sometimes insurance companies do make decisions about covering certain treatments because of public recommendations. So we are not sure yet if it's going to impact this recommendation that came out last week will impact coverage for individuals who don't meet that list. So I think there are still some uncertainties that will hopefully get ironed out ahead of the next respiratory viral season.
I mean, at this point, how do you feel as far as the immunity in the community? Because obviously we're now several years removed from the pandemic. We have previously, I remember speaking with you before when we'd have those briefings, the regular briefings during COVID about wanting to build up the herd immunity, the fact that you get the immunity both from the vaccine and also from having the virus previously. So I guess, do you feel like folks are mostly covered? Or, I mean, I know there's been talks recently of a new strain now that's circulating. Are there any concerns that folks might start to see that immunity waning at any point?
Yeah, I think it's, I'll say it this way. Certainly, there is a lot of folks have been exposed to the COVID-19 virus and several of its variations or mutations. But it's a virus. And so viruses, it's also a very volatile virus that's able to mutate pretty easily. And so just like with other types of respiratory viruses like influenza that mutate really easily, our concern is that, the virus gets smarter in its ability to be able to either cause more severe illness or to spread more quickly is always possible. And so I think it's important that even though we're not in the middle of a global pandemic without a vaccine available to us, that we do continue to monitor what's happening with COVID in the community and obviously work to ensure that we have tools available to us like vaccines that have been updated that are more effective against the strains that are circulating, because there are still people getting sick with COVID. There's still people who are dying because of the complications of it, and still people who are hospitalized as a result of it. And so ultimately, it's important that we continue to stay up to date on surveillance to ensure that we know what strains are circulating and what's the impact of those strains if it's any different than prior strains.
Now, I did want to touch briefly on measles, if I could, because I know recently here on WCNC Plus, we talked about the fact that there was an updated travel advisory for folks who might be passing through airports or train stations or really just any venues that are heavily trafficked where a lot of people are gathering. And there might be some concerns that measles could be spreading in these types of settings. Have you been monitoring those, warnings, I guess, from a public health perspective here in Mecklenburg County? We know Charlotte Douglas is a very heavily trafficked airport where a lot of people come and go and pass through. Any specific measures y'all are taking? Do we have any cases that you've heard about that are close to us at this point?
Yeah, so no cases of measles just yet. We did have a case of measles last summer here in Mecklenburg County among one of our residents. But certainly with what's happening in the southern western parts of the country with the high number of measles cases tied to the outbreak that began in western parts of Texas, as well as the cases popping up in various places around the country, it is certainly concerning. And so we are preparing here locally for what will happen when we do have a case of measles. And so just even a few weeks ago, we had a tabletop exercise that we hosted with all of our community partners to ensure that we were prepared for potential measles exposure in our community, as well as if we had to respond to an outbreak that was large scale. Measles is an interesting outbreak to manage because we have a very short window of opportunity that we can intervene to ensure that we get people vaccinated who are not up to date on their vaccines. And so we have a very short 72-hour window that we have to try to respond quickly in order to contain it. And so we have to make sure that our healthcare partners, our laboratories, our medics, as well as even the detention center is up to date on infection control and response procedures. And so that exercise was an all-day thing we did with our healthcare systems and other partners to make sure that we were ready in the event that we had to launch a mass vaccination campaign or investigation for measles.
No, I mean, I remember in kind of reading up and following along with what has been happening in West Texas and elsewhere, it sounded like, at least at last check when I had been catching up on the issue, that most of the folks who were getting ill they seemed to be unvaccinated. Do you see that as still the trend? And I guess if so, if that is the situation, what are your thoughts on just the state of vaccination right now for this disease, which at one point we had eradicated in the United States?
Yeah, and it's unfortunate that we're here. I think the reality is that most people in our community are vaccinated for measles, which is good. It is a highly effective vaccine in terms of its ability to be able to protect folks from developing infections or lessening the severity of infections. That being said, we do know that the number of kids who are not compliant with vaccines is going up, and the number of folks who are requesting exemptions from the measles and other childhood immunizations is also increasing. And so, while we do have, I would say, a great extent of herd immunity in the community because of vaccination, as those numbers of folks who are not up to date start to grow, our risk as a community starts to grow as well, that we'll have a large scale outbreak or measles will be introduced into our community, either from folks picking it up during travels or again, of course, small individuals, small babies who are not able to get vaccinated just yet because of their age, or not fully vaccinated because of their age, have gotten acquired it during travel, et cetera. So I think it's important that we continue to reinforce that we have a tool that's highly effective and useful to help us protect against measles, as well as other childhood vaccine preventable conditions. And so we want to make sure we continue to emphasize that for everybody, that that's an important step. And for us, keeping measles out of our community. And yes, it's true. The majority of folks who were exposed or contracted measles and the situation in Texas were folks who were unvaccinated. I think what's most concerning is that while we still have a relatively small number of people who are not vaccinated or up to date on vaccines or not choosing to be vaccinated, a lot of those families tend to be hyper concentrated geographically. They live in the same neighborhood, go to the same school, particularly when you think about religious beliefs that might be driving a person's decision to not get vaccinated. And so that does concern us more because when you have a large number of children in a congregate space, that are not vaccinated together, they don't have that protection of sort of herd immunity of having enough folks around them vaccinated. And so I think also what's important is that there's some kids who cannot be vaccinated because they have medical contraindications. So the rest of us who are able to be vaccinated, do that also for those of our neighbors who are allergic to products. For example, they're allergic to a substance that's in a vaccine and can't get it. And so having that high level of vaccination helps not just those of us ourselves, but also helps our neighbors.
And I mean, on that note of getting vaccinated, is that one of the recommendations for folks if they do plan to travel or if they feel like they're going to be passing through airports or any of these highly traveled areas? If there are even questions about their vaccination status, because I know I actually at one point when the news of West Texas started to kind of bubble up, this was obviously several weeks back, months back at this point, but I had people asking me, I was vaccinated before this certain date, I think, do I need to get vaccinated again? So I think there are a lot of questions about how long the immunity lasts and do I need a booster or any of that stuff. Are you able to kind of clarify any of the protocol for folks who are watching right now?
Sure, I would say for sure, measles again is a really effective vaccine and has a long life in terms of its protective properties. And so, in general, if you've been vaccinated, you were fully vaccinated as a child, you do not need a booster or any additional boosters. The only folks who might potentially need consideration for boosters are folks who may have a compromised immune system, and they may have their immunity may have waned significantly because of some other complicated chronic illness. In those cases, they should just talk with their provider. Again, that's not always and not often, but in general, most of us, if you've gotten the completed series as a child, you don't need to do anything right now. But if you have a child that is not vaccinated, my advice would be to make sure that kid gets up to date as quickly as possible. That is most important for everybody, whether you're traveling or whatever the case might be. It's if your child, particularly if your child is in a congregate setting, so if they go to childcare, after school, they go to school, they really should be up to date as you don't as on their all of their childhood vaccines, including the MMR vaccine. And then for adults in general, as I mentioned, there's not really anything to do with the exception of if you're a parent, watch your child for symptoms, and of course, get them up to date.
If I am, let's just say, vaccinated, so I know that my status is good and everything's good, but I am traveling through, is there anything else I need to be doing as far as this travel advisory to take precaution or keep me and my family safe?
Yeah, again, I do think that as it relates to young children who are not vaccinated, I think I would take caution and talk with their pediatrician about traveling to places where measles might be endemic or more prevalent. I think that would be an important conversation to have with the pediatrician before planning to travel, if the child is not up to date on vaccines. And then again, I do think that a child is most protected when they're fully vaccinated. So if you can delay travel until they reach the age where they can be fully vaccinated, I would certainly advise that as well. But again, it's a
I feel like
conversation that every family can have with their pediatrician.
I'd like to ask you too about the MEC Design Day, because I saw that coming up on the calendar, I believe tomorrow. You have a couple of sessions. You have a Latino engagement session, and you also have one that basically just spans from 9 in the morning till 3. So I figure I'd just pick your brain about that right now. What are you hoping from the community? What do you hope to learn, and how would you use that information?
Yeah, so that's a part of our community health assessment process. It's where we go talk about data and the health status of our community and also give our community partners and residents an opportunity to help us think about what we all can do collectively with the health department. Our health systems are hosting that as well with us to improve health in Mecklenburg County. And so that really is an exciting day for us to give an update on where we are with making Mecklenburg County healthy, and also to ensure that we get the kind of feedback from the people who experience life here every day. And to how do we build a system? How do we build neighborhoods? How do we build communities that make health possible for everyone? And so tomorrow is an opportunity for us to get together with about 300 folks to talk about their experiences in Mecklenburg County, both as residents and professionals, and to how do we collectively work together towards building a healthier community.
Is this your first event of this type, or have you been doing these before?
This is the second MEC Design Day. So we had the first one as a part of, we renew our community health assessment every 3 to 4 years with both of our health systems here. And so this is the second, we're in that process now of doing a new community health assessment. And so this is our second convening of MEC Design Day. The first one was just a couple years ago, a few years ago actually, and there were about 250 folks there at that event. And so we're excited to be able to have some more space this year at CPCC.
Yeah, I'm just curious back then, what was your takeaway? What did the community tell you about the needs that it had on the public health front? And are those needs still out there? Are you still trying to work towards, addressing those?
Yeah, so
Sorry about that, folks. Looks like we just lost our shot with Dr. Raynard Washington. If we can try to get him back, we certainly will. We're going to try to finagle that briefly. Jeb, any updates?
His computer restarted.
Oh no. Okay, his computer restarted. As you can see, the joys of Zoom are playing out, but I feel like we got a really great discussion from him covering multiple topics. So we talked about, of course, the COVID changes, the guidance changes that are coming down from the federal level, and also some of the advisories we're seeing on the measles front. So just as soon as we can turn this around and put this on our website, we certainly will.